Hi, I'm Rachel Long, and I'm going to be doing my IV video today. I'm going to start with my 12 safety practices. First, I would verify the care or procedure being performed. I perform hand hygiene before and after every procedure. I would verify policy procedure and gather my equipment. I would check the manufacturer recommendation on the equipment. I would knock on the door, use two identifiers to identify patient, note overall health of patient, provide for privacy, and explain the procedure to the patient. I would elevate the bed for good body mechanics, don proper PPE. Upon completion, I would lower the bed and raise the side rails per care plan and provide the call light and document all my findings. Okay, so I'm going to start with 6 o'clock and initiate the peripheral IV saline lock now. I'm going to start with applying my tourniquet. I would feel for the vein, and once I have found it, and I would clean the area and release the tourniquet. And while that's drying, I would come over here and set up my saline. I would push the saline through, making sure there's no air bubbles coming out. Set it down. I would then, once it's dry, reapply the tourniquet. And to apply my clean gloves. Man. I'm going to get my needle, my catheter. I would check and make sure there's no sheathing. I'm going to insert the needle bevel up. Once inserted and I've hit the vein, I would check the flashback for blood, and if that's good, I would then pull my tourniquet and pull the needle out. Tape down the catheter. Insert the flush. And then I would flush all 10 mLs of the saline through. And once done, I would lock my line, remove the saline, apply the sterile dressing, and I could also tape the line up here to keep the line sterile. And I would document any reaction the patient had and any abnormalities and how many times I stuck the patient. And now that I'm done, I would come back at 10 o'clock to give a stat order of morphine IV push. I would start by stating my 6 medication rights, which is right person, right medication, right dose, right route, right time, and right documentation. and how each of those would apply to IV push. I would grab my morphine and check my morphine for medication and dose against the orders I have, and they are correct. I would connect it, and with morphine I would push it within over 10 minutes. And while pushing, I would check for any phlebitis or any edema, any redness or bleeding. As I'm pushing the morphine, I would check the patient. I would check their breaths and make sure there's no hypertension present. Once done, I would remove the morphine and apply before I remove the morphine, I would lock my line, apply the saline, unlock my line, and while I would push the saline over the same rate that I pushed the morphine. And once done, relock my line, remove the saline, and I would monitor the patient for any reactions and document my findings. And then last, I'm going to hang an IV bag at 1, and I would have a pre-poked bag. It's got its insertions in here, and if not, I would insert it. I would once again make sure it's a new clean bag, and I would check the line, make sure there's no kinks, and I would flush the line out before installing. And I would once again check the patient for any redness or any phlebitis or anything going on. And I would connect the connectors. And I would set the rate for 150 mLs per hour over 8 hours. And I would continue to assess the patient as it's occurring, and I would document all my findings. Thank you.